Hi, my name is Jennifer James, and I will be talking about hospice. My target audience is the general public. I want you to imagine sitting in your doctor's office waiting for the results from a test you had recently. The doctor comes in and tells you bad news. You have a heart problem, or maybe a brain problem, or even cancer. What would you do? Most people would call upon a specialist, and for that, it would be a cardiologist for a heart problem, or a neurologist for a brain problem, and even an oncologist for cancers. So why is it that patients, when told that they have 6 months to live, that they don't think of calling a specialist on death and dying, such as a hospice team? Some of the reasons are myths that surround hospice. Many people believe that if they call hospice and sign on to hospice, that means that they're giving up. They're not trying anymore. And it's quite the opposite. A hospice team can help manage pain and symptoms with medications and other methods so that the person can actually live their life to the fullest rather than sitting in the doctor's office or waiting for blood draws at a hospital or even going into a hospital. Instead, they can have the care brought right into their home by the doctor or the nurse or the nurse's aides. Another myth is that signing on to hospice, the nurses and the doctors will hasten death, and that means give medications that will make death come quicker, such as morphine. Morphine is used, but not as an end to death. According to the University of Chicago Medicine, in 2010, they found that patients who received palliative care or hospice care earlier rather than later lived 2.7 months longer than those who just received standard care. Despite this, 35.5% of patients only are on hospice care for less than 7 days. So that's only 7 days of getting pain and symptom management and all of the benefits that hospice can provide rather than maybe receiving 6 months worth of those cares. Another myth surrounding hospice is that patients believe they'll have to go into a facility such as a nursing home or a hospital in order to receive hospice care. According to a study done in 2012, the National Hospice and Palliative Care Organization states that 41.5% of hospice patients receive their care at home in their private residential setting. 17.2% are in nursing homes, 7.3% are in residential facilities, 27.4% are in an actual hospice inpatient setting, and only 6.6% are in an acute care hospital setting. So most of these patients are in their own homes, receiving the care that they need, rather than needing to go into a nursing home. Hospice can benefit patients in so many ways. We need to get the word out and inform people about the benefits of hospice so that it can be utilized to help people with terminal diagnosis live their life to the fullest of the time that they have left.